The chocolate chip cookie, that is just to say that if you made chocolate chip cookies, we split a chocolate chip cookie. Your half of the cookie may have 20 chocolate chips. My half of the cookie may have 5 chocolate chips. Same concept with the fentanyl pills. You don't know where that fentanyl has ended up. So even if youth and young adults, any other community members, they think that that's a safe way to take that is just to split that pill in half. That would be safer. It's not.
The first of 3 Living Well Wednesday fall webinars kicked off September 17th with One Pill Can Kill, Opioid Crisis in Our Communities. This virtual learning series is hosted by K-State Extension, Family and Consumer Sciences agents and specialists from across the state. On today's Sound Living, an overview of the opioid crisis and the growing risk of fentanyl in our communities. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Jenni Ebert, community health educator for the Riley and Pottawatomie County Health Departments, discussed youth prevention strategies, key data trends, and hands-on guidance for responding to an opioid overdose or fentanyl poisoning, including the safe administering of Narcan.
I am with Pottawatomie County Health Department and the Jayson Ebert Foundation. I'm as well an employee at Riley County Health Department. This has directly impacted my family. We lost Jayson on September 5th of 2021 to fentanyl poisoning. Jayson didn't know the dangers of fentanyl, and neither did we. As a family, I hadn't heard of it prior to that day. The One Pill Can Kill campaign, the DEA federal campaign, came out September 28th of 21. I don't know if that information would have made a difference, but Jayson would have received some of that information. So I have 4 kids, Jayson, Justin, Jesse. Jayson also leaves behind Kaysen, his little guy. The reason I do this is because I don't want any other family to be in the position that we're in. So to understand the opioid crisis, we have to kind of understand the timeline on it. The first wave of the opioid crisis really started in the 2000s. That's when doctors were prescribing opioids at a high level and pharmacies were dispensing those. It wasn't until 2010 when they really started to dial back on those prescriptions. That's when they realized that the opioids were becoming very addictive. They were very easily addictive. Wave 2 was the heroin phase because doctors stopped prescribing those medications, the pharmaceutical medications. So people that were in the trenches of addiction took to heroin to fill that gap. Wave 3 is when fentanyl was introduced in 2013. And wave 4 was right around 2014. That's when fentanyl was being put into other substances like the stimulants and other illegal illicit drugs out there. We also have to understand what fentanyl is. Fentanyl is a synthetic opioid. It is 50 times stronger than heroin, 100 times stronger than morphine. Pharmaceutical fentanyl absolutely has a place. It is used by doctors every single day for severe pain, whether that be after surgery, advanced stages of cancer care. That is used. It's very effective. It's been here since 1960s. What I'm talking about today is the illegal, illicit, manufactured fentanyl. There are no quality controls with this. It's not being made in labs. It's not the same as the pharmaceutical fentanyl. The thing about fentanyl is you can't see it once it's mixed up into something. You can't smell it and you can't taste it. So you don't know that it's there until you start having some effects, some distress from that. And hopefully, if you do start to have any of those symptoms, signs and symptoms, somebody's there to recognize that. The cell phones, the cellular devices, any laptop, computer, gaming system that has that internet connection could be a way that someone is trying to market or to sell to your children, grandchildren, neighbors, family members, whoever. But this is really, it's a one-stop shop for the cell phones. They can market, they can sell it, you can buy it just right over the phone. So in all of those 3 steps, it can be purchased and delivered to your home like ordering a pizza. The illicit substance use among teens, 14 to 18, really have decreased from 2000 to 2022. The number of children using illicit drugs have decreased tremendously. But the children that are using are passing away at a very high rate. So less children using, but the ones that are using are passing away from trying that. In 2023, the Kansas Communities That Care survey implemented 2 questions about fentanyl into our schools. So 6th graders, 8th graders, 10th graders, and 12th graders take the survey. In Pot County, they do a really good job. They have a really high rate of the kids that are participating. These 2 questions, have you heard about fentanyl? And then the risk. If you have heard about it, then you go to the next question. The 6th graders, they haven't heard much about the fentanyl, but as the children progress in age, so does the awareness side of this. But it could be easily something that could be marketed to our 6th graders younger than that. So that's why this information is important. So we know we need to do some more awareness and education for that group. Most all of these ages, if they had heard about fentanyl, they do think it's a great risk. The chocolate chip cookie, that's something that I talk about with youth, with young adults, with really all community members. That is just to say that if you made chocolate chip cookies, we split a chocolate chip cookie. Your half of the cookie may have 20 chocolate chips. My half of the cookie may have 5 chocolate chips. Same concept with the fentanyl pills. You don't know where that fentanyl has ended up. So even if youth and young adults, any other community members, they think that that's a safe way to take that is just to split that pill in half. That would be safer. It's not, because you do not know where that fentanyl is at in that tablet. If it's all fentanyl, you have no way of knowing that. The opioid overdose to drug poisonings, if you knowingly ingest too much of something resulting in illness or death, that would be an overdose situation. Unknowingly ingesting something, thinking it was something else, resulting in illness or death is a poisoning. So often the younger demographic, they don't know that fentanyl is in whatever they're seeking, whether that be a Percocet, an Adderall, whatever they're purchasing. They are looking for a pharmaceutical pill and not knowing that the fentanyl is there and present. Both do the same. Both slow down the brain receptors and they will block the body's ability to breathe. Without air and oxygen, then your heart will stop as well. Sometimes someone is just offering up what people think is a true pharmaceutical pill, and they're finding out then later that it's not. So it's not. So many of the people that have been affected by the opioid crisis in this demographic, this age group, they weren't seeking fentanyl, like I said, but when it's in your system, these are some of the signs and symptoms that you could see. The thing to note on this is that the overdose or the fentanyl poisoning, it may not look like a dramatic event. It may truly just look like someone has just fallen asleep. So the importance of just knowing what these signs and symptoms are, to have the naloxone there, and first and foremost to call 911 and then use naloxone. Naloxone, Narcan, it's important to point out, Narcan is a brand of naloxone. So if you have Narcan, it is naloxone. We talk a lot about Narcan, but like I said, it's just the brand. But naloxone is the actual drug that is going to reverse an overdose situation. And how does this work? You just peel, press, and push the nasal spray either side of the nose, and you just press that. That naloxone enters and goes straight to the brain. You wait 2 to 3 minutes, and if that person isn't coming to, you can go ahead and administer the second dose. You can just move to the other nostril and give them the second dose. But again, first and foremost, you know the EMS is on the way, and get them the help that they need. So after administering naloxone, the hope is that it has then kicked off the opioid on the brain receptors and restores that breathing. That's what everybody is hoping for. But again, sometimes it's taking multiple doses of naloxone because you don't know how much fentanyl a person has consumed. In 2021, there were over 107,000 deaths from drug poisonings or just drug-related deaths. That's enough to fill the Arrowhead Stadium and Kauffman Stadium. In 2022, there was 110,000, 23, 112,000, In 24, we've seen a decrease, and that's 84,000. That is in part to the naloxone being distributed lots of places. It's being put into lots of communities so people know that it's there and it's accessible and it's making a difference. There's lots of things that can be done. And like I said, the most important is just learning and being aware of what's out there and having those open, honest conversations. I can't stress that enough for parents, caregivers, aunts, uncles, teachers, coaches, just to continue this conversation. You don't have to know all the numbers and everything as far as data points, but just continuing the conversations with our youth, what's out there, what they're subject to, and how to have a safe community is huge. Also, advocating for yourself for medication is important to do. The safe medication storage in Pot County and actually in Riley County too, we're doing the safe pledge, the pledge to lock your meds. So caregivers, community members are taking a pledge to secure all of their pharmaceutical prescriptions in their home. And then we also talk about if you're done with the medication to go ahead and get that to any of the pharmacies that have the drug take back sites, just to go ahead and get those out of your home. With that being said, information out of KTRACS, the website that tracks pharmaceuticals through the state. You can narrow it down to the county. And in Pot County in 2023, we were still at 58 out of 100 people were still getting opioid prescriptions. These are true, legitimate pharmaceutical prescriptions. I was surprised to see this number this high. Hopefully soon we'll have updated information for 2024, and hopefully that number will be a lot lower. It's important to note this does not mean that half of our residents have opioids. It means likely that prescriptions were written to the same individual. So it's not that many people out of 100 all have that prescription. The breakdown on the fentanyl, this is just what the DEA, so the federal level government, has seized. In 21, it was 20 million fake pills. 22, 50 million fake pills. 23, 78 million fake pills. 24, we're starting to see that decrease, so 60 million fake pills. Point being made is the supply is still out there, so we're not through this. And the devastation on younger adults, well, any person in any family, one of the increasing demographics is our little people. So toddlers are passing at a high rate right now, and that's just due to exposure from fentanyl. So that's something that they're trying to watch and really get ahead of, but we're losing even our little people now. The more that we talk about it, the more compassionate, the more caring we become as communities. It breaks down that stigma of, oh no, that doesn't happen. That won't happen here. I'm here to tell you it does happen. And it happens in all communities, whether that's a rural community, or the big cities. It's here, and we just have to give our kids the information they need to make good, healthy choices for themselves, because we know that they can. We just have to do better, be better as far as talking with them about those things.
That's Jenni Ebert, Community Health Educator for the Riley and Pottawatomie County Health Departments, with information on the opioid crisis in our communities. The Living Well Wednesday webinar series continues October 15th with a program on how to recognize, avoid, and report scams with Ed Burr, an investigator with the Kansas Attorney General's Office. For the November 15th webinar, Johnson County Nutrition, Food Safety, and Health Agent Chelsea King will discuss energy drinks and how they can lead to negative health effects, especially for children and adolescents. For more information or to register for the fall series, search Living Well Wednesday Extension. Once registered, you'll receive notification to join the monthly webinars. Recordings and other resources are also available on the website. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.